when it comes to exploring treatment options for a person with schizophrenia, you've already spoken about it. Um, Looks like just a psychiatrist or just a counselor, just a psychologist does not help. That's that's a part that we get down to an understanding, and this is also out of my personal experience that they will always need a team. Um, at what point should the families approach, and at what frequencies should they be in touch in case an individual is living with them in the society, or if he is an individual who is a working individual living by himself? In either case scenarios, what's that frequency and what's that ideal? Is there an ideal approach there?
It will be mostly specific to the needs of that particular individual. Depending upon what the needs of the individual are, we will have to support that particular person. So this problem, though we have come to an understanding that this is more of a biological problem, it's a disorder of the brain. It is no more just that the way he was, the upbringing or the nature versus nurture, which was a big debate, or which still continues to be a big debate. Of course, nurturing do have its own role to play, but we know that the nature, that's the biology, that's his body is. There are some issues with that. There are some impairments in that which leads to this particular illness. And the model of care, for the best model of care, and especially for us, the evidence-based model of care that we have been following has been biopsychosocial in nature, because our starting point is always been psychosocial and biological part of it being plugged into the system. So medications, as we discussed, is the first and the primary one, and along with that, they would need help to understand the problems that they are going through. As we discussed about the insight not being there, there are a lot of insight-oriented, insight-building therapies which are done by the counselors or psychologists, where we help the individual do that. Second, because of having the illness, they will have some impairments. Okay, their understanding of life situations, their understanding of their relationships, taking the responsibility, there would be some impairments, there would be some issues there, which needs to be addressed. And that needs a dedicated professional who is trying to do that. It could be psychologists or it could be psychiatric social workers who can do that.
So and each individual might need a different person. Sometimes when they become functional, they might need a psychologist and a counselor supporting them through.
So when it comes to the occupation, when it comes to the interpersonal issues that is there, okay, they might need a psychiatric social worker or a family therapist who can help them.